Good morning, everybody. This is Jason Small with the Executive Secretary of the Montana AFL-CIO. And today we have some members of the United Association of Physicians and Dentists. We have Dr. Bussey, who is the president of the association. And we also have Alexandria Honey, who is one of their organizers and very responsible for some really big wins up in the Flathead area over the past month or so. Anyway, Dr. Bussey, thanks for joining us today. And also, to start, a lot of folks don't realize that many providers actually have their own union. So, can you tell us a little bit about the UAPD?
Certainly. Thank you for having us, Jason. UAPD was founded in 1972 in San Francisco by a bunch of private doctors, interestingly enough, who did not like what some of the Medicare regulations, wanted to be independent and have a voice in their hospital. So, ironically, it started with private physicians and then spread to the state of California and the various counties in California. In the last 10 or 15 years, we've fielded many phone calls from across the countries from private institutions such as Logan Health in Montana. Their members want a greater voice in the healthcare. So we've been spreading across the country. We're now in 8 states and, fielding inquiries every day. We have a variety of providers, mostly doctors and dentists, but also nurse practitioners, PAs, and other affiliated fields.
Excellent. Where is the majority of your membership located?
Majority's in California. As I said, we spread across the state in the 80s and 90s. But as healthcare become industrialized, it's less of a profession. So people feel, not heard. And, Alexandria over on my right has, got an inquiry from Logan Health up in Kalispell, and we responded to that. Mostly
Excellent.
California, though.
Right. So, Alexandria, what was the driver? What caused them to reach out? I'm sure you've had a lot of great conversations.
Yeah, definitely. So it kind of started with a small group of providers who initially went to management and, continuously asked for changes to be made to help provide, better patient quality care. With little to no avail. So, after multiple attempts, they kind of wanted to take matters into their own hands and reached out to us to assist them with that too, so they could feel like they have, a bigger voice in their workplace.
So, would you say that that's the key concern for providers, or what was the largest driver? What did they, what was one of the more specific things that they were asking for, and what was their issue with what was currently happening?
Yeah, so we do have a group of, it's mainly primary care, but we have a couple other groups in there, which is like urgent care, internal medicine, and each of them have, their own kind of difficulties that they face each day. I guess the straw on the camel's back would be, there was a large wage cut that they had proposed. And then, retention with staffing. They've lost over 20 providers in the past 2 years, which kind of leaves all those patients displaced and moved around. So I think that, between those two things, and then also just, like I said, staffing, wage cuts, retention, things like that, really just drove them to want to see a better workplace environment for themselves and for their patients.
Yeah, it's a zero-sum game when it comes to administration of healthcare, Jason. And, with these 20 providers left, all the workload fell on the others. I can tell you, I've been a family doctor for the last 40 years, and it's more of an assembly line now. And when you get private administrators doing this, they look at the bottom line. The finite amount of money goes out, and if people drop off in their panel, that's too bad, and they are slow to replace them. So that pressure was one of the drivers to have a better patient-doctor relationship, more time with their patient-centered model.
Mhm.
So, you're kind of saying over the years a lot of things have shifted. So, what does your day to day, basically what's your day look like every day now? How has it changed up from the past? Is it just primarily workload, or do the hospitals expect you to handle a much broader and more diverse workload also?
Well, I'm family doctor. I've been a family doctor for longer than I can remember, 40 years. I've been working in a variety of situations, private, public, and the common denominator is the insertion of administrative philosophy into the patient-doctor relationship. It used to be a straight line, doctors and patients. Now it's like a triangle where the administrators are on top are telling one thing to the patient, what they should expect, for advertisement. We'll do this for you. We'll put you into a spa. We'll do all these tests for you. And on the other hand, they're telling the patient, providers another thing like, don't do this procedure unless it's absolutely medically necessary. And we'll give you incentives if you are more financially efficient. This is not good philosophy for patients and doctors. They've inserted themselves. That's what the common denominator of my practice in California and what I'm hearing in all the other states. The doctors need a voice to provide more efficient delivery, and they need the patients to advocate for them. We had a town hall in Kalispell a couple of weeks ago. It was very similar to what the providers felt. There was inefficiencies, confusion on the administration or scheduling, centralized scheduling versus local scheduling. Patients and doctors have the same frustrations. We want to, take back our profession and help the patients.
Excellent. I know you're going to be having negotiations coming up here pretty soon. Is it fair to ask you, what are you really shooting for there? What do you want?
Yeah, so, some of our doctors have listed their concerns specifically. And then again, it's always going to come back to those wage cuts, panel sizes, staffing. Those are probably the main three, like I mentioned before. Those are kind of where we're hitting at. And then just, a better overall protection for them and just being able to give them a voice. So when these kind of issues come up on the next time, we can have a good relationship with the employer and be able to sit down at a table and all kind of address our concerns and work as a team to provide better care to the Flathead and Kalispell and surrounding areas. So, it's not only just about negotiations, but it's the overarching future of healthcare in Kalispell and what the union's able to provide as far as, I guess, sitting across the table and all being able to have that conversation and have a voice. So when things do decide to change or when other changes come up, they can be at least say with their piece in it as well.
Yeah. One of the concrete ways that this can be done is what we do in other contracts, Jason. Have a labor management committee, have a couple or three of our doctors meet regularly every 2 or 3 months with the administration to talk about the nuts and bolts of how to deliver, what kind of equipment, what kind of scheduling is more efficient. Sit down and have that voice that Alexandria was talking about. And we're going to try to get that in the contract.
Excellent. So how far along are you right now? How far along the process?
Well, go ahead.
Yeah, so we just finished the election, which we had a 64% majority in, which was super exciting. Most of the providers came out, shared their voice, and this is something that they really wanted. So we just went through the union certification process. So next steps are kind of sending those demand to bargain letters and getting started on building those teams and moving from there. So we're just in the very beginning stages of this process, and we're very excited about it. The providers are really excited to jump on board. And
oh, that's great. So I guess what is there anything else you'd like to add? What would you like the folks around Kalispell and the Flathead to know about your membership, what you're negotiating for, or even your overall goals?
Yeah, our overall goals is to improve healthcare and concretely the time and the satisfaction of the patients in Kalispell and Flathead. They want a better experience. They want to feel like what it was back when I started in medicine many years ago, that people are listening, that the doctors are caring, returning their calls, and having enough time to think things out, to get the right diagnosis, and to make sure people are satisfied. In order to do that, we want to form a partnership with Logan and have that triangle I talked about, really, be more efficient and have them listen, have the administrators listen and have the providers listen. And we need the townspeople over in that area to support us. As I said before, we felt very good about this last town hall. and we'll be communicating with people in this area during our negotiations.
Great. That's spectacular. And, on behalf of the Montana AFL-CIO, we are excited to see you, and we're looking forward to working with you folks over the years, and hopefully keep the ball rolling and make everything better for everybody. So
definitely.
Appreciate you.
Thanks very much for your support.